you so much.
This is the last time I'm going to do this.
I totally understand. Totally understand. Thank you. Thank you. Broccoli? Did you have broccoli today? Oh, sorry. I didn't see you there. Today's talk is going to be on tramadol, the use of tramadol, when it's appropriate, and it's a long story. When it's appropriate, and what I think about tramadol as a pain-relieving med in general. So tramadol, as you guys know, works, it acts on mu receptors, so it does act on the opiate receptor, but it's considered a non-narcotic. I think it's key when people ask for a pain medication and they want a non-narcotic type pain medication for whatever reason. So it's a good alternative. It works great for mild to moderate pain. I don't think it's a good choice for more severe pain episodes. So it's a good tool in the arsenal. The problems with tramadol are as follows. One, it binds to the mu receptor, which we discussed. However, it also blocks the reuptake of norepinephrine and serotonin. So what patients do I think tramadol is not good for? Patients are on psych meds, SSRIs, any kind of medication with a long psych, patient with a long psych history. It is also significantly cleared by the kidneys, as opposed to most other opiates that are cleared hepatically. This has kidney required elimination. So elderly patients, we tend to want to kind of bring the dose down. They recommend a total of under 300 milligrams per day in elderly patients, under 200 milligrams per day in patients that are on dialysis or significant hepatic or renal dysfunction. A good rule of thumb is if you give everyone 500 milligrams Q6, you'll be under that 200 milligram limit. You won't have to think about doing dose adjustments, changing to Q12 or as such. So 500 Q6 I think is a pretty safe dosing scheme for patients in mild to moderate pain. I'd stay away from it in patients that are have renal dysfunction when used over 3 days, or in patients they're on a lot of psych meds. But I think it's a good tool in the arsenal. I think low dose opiates are equally as good, but it's not a med that I say don't use at all. It's just something to just take a note of. Again, something that I think is not a bad medication.